Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's podcast. We're talking about tales of the tail, and we always learn something new when we're researching for these topics. There's always an interesting fact that we find out about, like there was some more muscles that, we were exploring that aren't always in a lot of the textbooks. And so, yeah, we always enjoy it too. So how are you going today, Soph?
Going really well. Yes, there's lots of interesting stories and times when we've realized that the tail was a very important factor in doing body work for a horse or for their comfort. So it'll be a good episode.
Yeah, like the tail is really important for the horse, obviously. Like they use it to swish flies, and you'll often see them if they're in with other horses, like they'll stand nose to tail, so they're using each other's tail to keep the flies off them. So it's very useful in that situation. It also gives us a lot of information about their behavior. So like when we're watching them being worked or ridden, we can see if there's tension in the tail, if it's being held in a certain way, if it's, that's what it's called, a ringing tail. If the tail's like ringing, like twisting, especially if it's involved with like certain gaits or movements. And Sue Dyson, who's developed the ridden pain ethogram, the tail's a very important part of recognizing pain and lameness in horses. What else is the tail used?
It's a very useful chew toy for foals. There's a lot of mares getting around with a short or missing part of their tail, which isn't always aesthetic, but must be okay. Yeah, lots of mares get crib stop in their tails for chewing foals, and also for reprimanding us when we are not listening or being annoying. Horses are very good at flicking us right in the eyeball, flicking us in the face, and telling us when we need to listen.
Yep, I've been flicked in the eyeballs a few times. So it's usually mares and they have very precise aim, and it's very painful. I have one particular mare that she's very clear and expressive with her tail. And the one day I was standing there with the owner chatting, and she decided like it was time for her to be fed or go back or something. And he was like over a meter away from her, and she got him with her tail, and he knew exactly what her communication was saying. Like, excuse me, you've left me tied up here for long enough. I am ready to go. So
Very
yeah,
communication.
it's quite a good communication aspect. And
Yes,
it
and
can
I
be also good when you're working with the hind end. If you just hang it over your head a little bit, it's actually a good fly protector for us too.
the flies, yeah, the flies aren't too bad. I do sometimes get flicked by mares when they say that I've done too much with their foals. Like, you need to back off now. Leave my baby
Yeah, it's
alone.
very
Yeah,
interesting. We can easily dismiss some of those communications. So it's
definitely.
super important.
So if we think about anatomy of said tail, how would you start off describing the tail anatomy?
Yeah, well, there's 15 to 22 or so caudal bones. So the caudal bones are the tail bones, and they should have a junction with the sacrum, which is called the sacrocaudal junction or joint. But sometimes one or two of the sacral vertebrae the caudal vertebrae, the tail vertebrae can fuse to the sacrum. Um, and so then it's going to have a different, like the junction's going to sit in a slightly different position, like a bit more caudally. The first two to three tail vertebrae sit within the rump, so they're not like
The dock.
yeah, well they can be at the top of the dock, but it kind of is more like where the dock sits up on top, if that
Yeah.
makes
Yeah.
sense. Like
Yeah.
it's that junction as the rump goes into the dock, but it's sitting like more within the bum, if that that's probably easier way to describe it. And then the rest of the tail is a bit more free flowing, which is how you described it. I just want to talk about like that the muscles go around the tail. So like there's muscles on the top, on the sides, and on the bottom. And then there's muscles that are kind of connecting into the like pelvic diaphragm area. So what are the top muscles, the dorsal muscles?
So the dorsal muscles of the tail are sacrocaudalis dorsalis. So there's medialis and lateralis. They are a continuation of the multifidi, which are small muscles along the spine in in the horse's body. So they are very important for spinal stability, and those are really important for just like the fine motor movement, but also like they're capable of going very fast and also very slow. So they're quite dynamic. The medial portion, so that means the side part of the sacrocaudalis dorsalis medialis muscle, begins in the sacrum, and it's for inclination of the tail. It helps with bilateral levitation or extension. So that means like lifting or being pointed out behind. And it's very important for neuromotor tail control. The lateral portion, it's that lumbar area coming back and attaching into the tail. So it just means that you can, see horses how far they can bring their tail around. Like I see horses. I was watching one the other day actually. When she flicks her tail, the tip of her dock hits up on top of her rump. So there's a
Mm,
huge amount of motion in that lateral flexion, bringing it all the way around. So it's very important. So you can understand the muscles on the side are actually very strong, lifting the whole tail up and throwing around as well.
And they should
Um,
be able to comfortably lift the tail up over their back. Like it's not something that you should
yeah.
do. And I've seen tail jacks be applied to foals, and we used to do it a lot in cows. It would immobilize them, but we don't do it in a horse. It's not an area that you want to mess with. It has spinal cord connections like into the sacrum. Um, and I just want to also talk about that sacrocaudalis dorsalis has a connection into the supraspinous ligament, which connects all the way from the skull along the neck to the withers, all the way along the back. And it's very important because then when we start to see tail tension and things, and we think about those connections, deep into the multifidi, like you mentioned, so deep into the rest of the spine, the multifidi run all the way along to the neck, and the supraspinous ligament connections. Like we can understand how, problems in the back and the neck is going to influence tail tension. The other thing is that if these muscles are atrophied or if there's neurological signs like the horse is struggling with control of their legs or the tail is flaccid, you need to call the vet because there's a neuromotor connection into the spinal cord. And so that the tail, that neurological connection is also important for defecation and urination. And so if you've got a tail that's starting to show flaccidity or weakness of the muscles, loss of tone, then you've got an issue going on that you need to investigate further. What about the ventral muscles?
So ventral muscles of the tail, ventral being more towards the underside. So you've got the sacrocaudalis ventralis lateralis, and there's also the sacrocaudalis ventralis medialis. So the medial portion, which is more on the midline, so the very bottom of the tail, is involved in clamping the tail. So when you can't lift the tail, that's the muscle that they're sort of using to clamp the tail down. And then the lateral part, the sacrocaudalis ventralis lateralis, which they're all a mouthful, has to do with, yes, pulling the tail down, but also lateral flexion as well. So it's kind of like a clock face. They're arranged around the tailbones so that you can basically move in any direction that you want to.
Yeah, it gives such a big range of motion.
such big range of motion. Another lateral muscle is the intertransversalis caudalis. Other muscles we have are levator ani. This is very important, the part of the pelvic diaphragm. It's broad and thin. It has a role to play in defecation because it pulls the rectum or the bum hole cranially and ventrally. So this is very important for closing the pelvic outlet, and a lot of horses, they love when we do stuff in there and sort of massage those muscles. There's also the coccygeus. So that pulls the tail ventrally and laterally and stabilizes it while they're doing, while they're passing manure. And all of this space has very important connections to the internal and the external fascia of the pelvic diaphragm and the pelvic floor, which are really important. And I didn't used to think they were as important because obviously for us as humans, they're very important, but we're a biped, like we're stacked, which means that our organs are pushing down through gravity, and there's lots of reasons to work on your pelvic floor, whether you're male or female. But for horses, it's also very important. I think, we have quite a focus on the core and abdominal muscles for supporting the organs, which is very important, absolutely. But those connections at the end and their health and their motion is also really foundational for the horse.
Yeah, and the support of the abdominals and the transmission of energy, from the hind end through to the front end. That pelvic diaphragm is really important for that. These muscles are innervated by the sacral and caudal nerves, and I have treated one horse that had some kind of injury occur where her tail became flaccid. She struggled to urinate and defecate. She got atrophy of her rump muscles. Um, and, we didn't manage to fully rehabilitate the function, but we got her to a point where she's able to live, and she was also able to have embryo transfer and able to get enough function back in her tail and also in her rectum to defecate and urinate and not kind of get problems because of that. But it was a really long process, which with a lot of treatments from myself and another vet who did acupuncture and taping and owner rehab exercises and things like that. So she's probably the worst one that I've seen, and most people would have put her down, but she was quite happy within herself. Like she wasn't really miserable about it, and she's, she's living a good life. So in terms of connections, the tail is so connected. And when I did a dissection recently with the biomechanical medicine group, was one practitioner in particular, and he was just so interested in the connections of the tail. And it was super cool to watch him playing with the tail and like seeing, if you move the tail, what connections moved, like could he feel it up in the diaphragm? Could he see it going through the psoas? Like, how much influence could he have by really just focusing on treating the tail? And it's it was super cool. And I think we can work on any part of the horse and have a big influence on the entire horse. Like we've seen it with the hyoid and changes in the hind end, stride length, and we've just got to recognize it's all connected. But the tail connections, like through the spine, is pretty cool, and it means that we can influence the entire body through working on that tail, and it can also be an indicator of like body tension and comfort and all of that. So there's a lot of connections. So that's the one along the spine, like especially through the those muscles that we've talked about, their connection into the body. And also fascially through those connections, like the deep dorsal myofascial line, the deep ventral myofascial line, like they continue from the tail and go all the way to the front end of the horse. What other connections do they have?
The pelvic diaphragm, which we just spoke about, also into the hamstrings. So the main when you talked earlier about the few caudal vertebra muscles that are sort of just up from the dock that you can really easily move around with your hand, in the semitendinosus muscle, which is a hamstring muscle, comes from the back of the leg, goes over the tuba ischi or the point of buttock, and then it wraps around and comes up onto those caudal vertebrae. That's where the origin of that muscle is. So the hamstrings have a direct anatomical connection into the tail itself. And so it's a very secure unit up there realistically. And there's still a lot of motion, like they're synovial joints. We're hoping, there are times when there's fusion between the sacrum and those caudal vertebra, but there is motion there. So the semitendinosus or hamstring muscles into the tail and also from the tail back are important. If you have a lot of, we're talking about the tail itself, but there are other things that can influence the tail, like these hamstrings and their tension. When we talk about that deep dorsal, did you have a comment about the hamstrings?
Can you tell a story about the hamstrings and the tail?
Oh, yeah,
I don't really remember this, but you remember.
Yeah, it's such a foundation. I just remember it. I actually remember the visual of sitting in the arena. There was a combined clinic with Raquel and Terza Hendricks from Functional Horse Training. This was 1, 2, 3, 4, 5, 6, maybe 7 years ago.
It would have to be.
Yeah, and I'd just done Raquel's subjects at uni that year, and so I was super into, just learning about the body. And at this clinic, there was a horse who was having a lot of trouble just doing any of the exercises. He was really stiff and struggling, and you gave him a little bit of body work, but then you taped his hamstrings. And I remember it was blue tape. That's how clearly I remember it. He was chestnut, blue tape. I even remember what the owner was wearing. And I remember what you were wearing. That's so funny. This is a really foundational message for me, just how connected things are in the body. And Raquel, you taped his hamstrings, and then a moment later it was like you were just checking, just like, oh yeah, that's all neat and symmetrical. And he just lifted his tail up so easily, and he was yawning and he was licking and chewing and having a good time. And the owner was like, oh my God, we have never, ever, ever been able to lift his tail. It's a hard no for this horse. And then she cried and she gave you a big hug. And I did see her again at some point, and she said that he'd continued to improve. But so that's, there's a big connection.
Important that connection is, and sometimes you treat one and it sometimes treating the tail might be the key, but sometimes treating something else like the hamstrings or the sacrotuberous ligaments or pelvic balance, abdominal function, there could be another key that releases the tail. It's not always tails restricted, treat the tail. It's follow the pattern through the body and figure out where the areas of tension are. But yeah, that's a cool memory because I forgot about that one.
Yeah, no, it's really stuck with me. Yeah, it just demonstrates again the connections, anatomical, including fascial, nervous, soft tissue, the bone. There's just so much that's there together. For example, that deep dorsal line, it includes, so these are the myofascial lines, which are from the myofascial kinetic line textbook from Ricky Schultz and Tove and Vidke. When you consider the deep dorsal line, that goes from the ventral side of the sacrum and the underside of those tail muscles we talked about. They travel around the organs, go all the way up and go forward to the ventral. Yeah, up and through the ventral longitudinal ligament. So that has a direct connection to the stability and the support of the spine and the input that goes all the way up to the underside of the occiput, of the base of the skull nearly. So
we could treat the tail and be influencing the head.
And when you look at the deep dorsal line, so you've got that travels forward. I know you made some comments earlier about the supraspinous ligament, but it makes its way all the way up through the nuchal ligament. To the top of the head. So, super connected.
Also sacroiliac ligaments as well? Through there too?
I can't remember. I would say so. I was just looking at how far they go. Yeah.
I mean, it's such a...
and The deep ventral line goes through the ventral sacroiliac ligaments as well. So very connected.
Yeah, so there's a lot of problems that we see in the tail. I think the biggest one for me that causes horses the most angst, it's often related to to a horse that's quite anxious and jumpy, is when the tail is clamped and you go there and they just like clamp down as if they're going to sit down. And then usually, I have to ease my way in with that a lot, but I look at the sacrotuberous, the sacropelvic ligaments, sacrotuberous ligament, and if I can get in there and work, I have to work very respectfully and carefully because they're ready to kind of jump away from you at any moment. It must, just be so uncomfortable for them. But if we can release those, it's like a new horse. It's, you know, helps their whole pelvis function, their tail function. They also just, their anxiety often disappears. Um, and sometimes a clamped tail has come from fear. They've, I don't know, had just bad experiences where they might have been reprimanded a lot and they've jumped away, or it's come from tension that's created that clamping. But it makes a big difference to the entire horse and usually with a clamped tail, it's not the tail I'm working on, it's the sacrotuberous and sacropelvic ligaments. What other things do you see with the tail dysfunction?
Well, flaccid tail. So if your tail has no tone or neurological function, so neurolog or just function in itself. If your horse can't lift their tail, say to do a wee or a poo, then
Floppy.
yeah, it's floppy and it's floppy in your hand and they don't flick it around easily, then you want to be making sure that probably go and see a vet about that. That's really important. That's definitely worth calling the vet for because neurological function in that area can be impacted from those caudal and sacral nerves that you were talking about earlier. What else?
I reckon I have seen a perineal hernia, and that's where like they'll have like a bulge beside the anus, and you're like, oh, why is that? Yeah, I'm trying to
Yeah,
think.
I've actually seen that in horses who've missed when they've been foaling. They've,
Yeah, and the
they've it's gone through up beside the anus, and they've either it hasn't perforated through, but you've got a permanent
yeah.
change to the tissue.
Yeah, so if they've got kind of that bulging beside the anus and they've got a perineal hernia, then the pelvic diaphragm, which is so important for like structural support of that pelvis and transmission of energy and motion and function, is compromised. And so, you know, that's maybe a horse that you'd want to think hard about breeding. I wouldn't recommend it. And riding even, because, if that pelvic diaphragm is compromised, they're not going to be able to really give you good self carriage. Like there's going to be compensations relating to that. Um, there's also a paper that talks about when the tail is pulling to one side, that it's indicative of lameness. It doesn't mean that the lameness is on the side that it's being pulled to. There is tension on that side, but there is likely a hind limb lameness there that needs to be investigated. Um, and like Ellie at the moment, so she's had a big disconnect to her pelvis, and I mean, I even wonder about the health of her diaphragm, to be honest, because she's had weird shape to her ribs and her belly connection, right where the diaphragm sits. There's a funny shape there, and I'm like, I've seen damaged diaphragms under dissection. Um, but yeah, I went to lift her tail the other day and I was doing some what we call spinal flow on her tail. And I could feel a restriction on one side, onto the left side, which followed all the way up like her spine. And actually felt like it crossed over. But uh, then when I went to lift her tail, she was like, hell no, don't do that. Like she wasn't a clamp tail where they fully clamp it down, but it just had a increased tone and it didn't comfortably want to lift up. So you can pick up more subtle signs in your horse's tail, like don't just go in and like pick it up, but like go in, gently lift it. Just feel like it should have a tone. It shouldn't be too much tone and it shouldn't be flaccid. And then like, how far can you comfortably lift it? The horse should stay relaxed, calm, not move around, not step around. And then like, can you do little circles with the tail? And does it feel like it's comfortable in each direction? And what happens when you let go of the tail? Like, do they just kind of like have a little reflex? "Ugh," or is it just, you can get the tail and you can do a nice like flow through the whole tail. It can give you a lot of information because if there's stuff that you're noticing in there, then I would recommend that you get a body worker out to assess, and it is significant.
Something that we actually hadn't talked about, but I remember seeing a mare not long ago that melanomas
Mm.
often gather around the tail area, especially
Okay.
on your grey horses.
Yep.
But she had melanomas that were, I think, affecting her muscle function, like
Yeah.
on the underside of her tail. And it wasn't really a consideration, but it was causing a lot of, like, you're often concerned about it from it's a cancer perspective, but I think it interfered a lot with um, her sacrum and her
Yeah.
pelvis just because she was moving her tail quite stiffly. And so the implications back into her body, she wasn't very comfortable. But she improved a lot with body work. So maybe just making sure that if you have melanomas there, that um, the comfort of the rest of the structures isn't being compromised as well.
It's a good point because, when we do see melanomas under dissection, they often invade muscles. Or it's not even invade is the right word, but they kind of destroy the structure of the muscle. Like I've seen photos and of where they're under the scapula, for example, and like the serratus ventralis muscle is gone, like it's filled with melanoma. It's like mush, and so it changes the structure of the muscle. And so I've never, often they're like hard lumps under the tail, but that's an important consideration. Like, how is it influencing the biomechanics of the anus, the tail, the pelvic diaphragm, because often they're internal. Yeah, and then how does that have a flow-on effect through the entire horse's body?
Yeah, especially those older horses, they can be very polite about
Yes,
things, even when it's a bit uncomfortable.
definitely. So, what does a happy tail look like?
Happy tail, love to see a happy tail. Um, soft and flowy. So this is where, I mean, a happy tail is different from a pretty tail because a pretty tail, of course, is full and lush and shiny.
You can fake it too. A pretty tail can kind of fake it, and so you can't see that it's not it's actually an unhappy tail. There's just so much tail. It's like,
Yeah, maybe, yeah, you could have a tail with tension, but all the weight is just holding it down.
yeah,
Um, so a soft and flowy tail. So not held up and out behind. It should just align nicely with the sacrum coming across the croup and then have a gentle angle down and hang behind the horse softly. Um, in terms of tail tension doing things, they can have a mild accommodation to the movement that you're doing, like lateral work. So I've seen some beautiful videos of, soft lateral work, and the tail will just have a slight and gentle curve, usually to the direction that they're moving in. If they're just doing lateral work at a walk. But it looks it still looks connected with the body. It doesn't look like it's disconnected or that it's tense or accommodating. Um, I know you were saying that this happens with Jelly a bit. It also happens with Charlie. He often, when he's feeling a bit tense, the instant that he stops walking, his tail will go down. And then when he strikes off and starts walking again, his tail just pops up out behind his bum and it'll hold up behind while he walks. And he has a very thin, sad tail. It's not very impressive at all, but and yeah, so it sits out behind, yeah, his tail itself sits out behind.
mm,
And I just know that when he's more comfortable, it immediately reduces the amount that it's doing that. So you don't, ideally, a very soft and flow tail sits nicely against the rump
yeah,
with
or
no,
just it's just a flow, like it just flows from the spine all the way through.
Yeah. You can easily swish flies. So we're talking about a really uncomfortable tail wouldn't be able to just easily kind of, it looks lazy. When there's a comfortable
Yeah.
tail, they just kind of, all they have to do is do a slight flick, and the motion carries the bottom bit of the hair and it just flicks up and gets a fly. It just looks really easy. Whereas when it's super tense and they don't want to bend the tail, that it just kind of bends at the junction of the rump to the tail. And it just looks all stiff, and it kind of just goes left, right,
It
smack,
hurts
smack.
more when it whacks you as well because
It
there's more
hurts.
stiffness
It
in there.
does. Yeah, yeah. A happy tail lifts out of the way during defecation and urination. So they can, yeah, very comfortably move it right out of the way. And also we can move it and lift it up, and it's still comfortable. So that there's a positive tension. So it just feels like the horse, like it's just resisting gravity, but it's not tense, it's just trying to not, yeah, there's no brace or flaccidity, but it just feels like it's connected to the spine still.
Yeah, it really flows, and it can be hard to see your ta horse's tail when you're actually riding the horse. So I often will look in the shadow, like, and see because you can see if the tail's being like held up, or obviously video yourself. But yeah, like with Jelly, because he has pelvic probably pathology, lumbar pathology, as well as he's had his muscle condition tied up a lot. Like he always has a little bit of tension in his tail. I can get him to the point where there's flow, but there's always a little bit of tension at the top. And I believe that that's just his pathology that he's got. Like, he's had it for however many years. That's what we have to work with. But yeah, it's still an indicator for me because if he's holding it really up and still, then I'm like, there's too much tension in his back. Whereas if it's up a little but it's still flowing, then I'm happier with him. But for another horse, that might not be the case. I want it more flowing. So some things that can cause issues in the tail, like thankfully, not many people use cruppers these days, but cruppers can really cause a problem, especially in ponies. Or if you've got a horse that's pulling a cart or a wagon or something and they put a crupper on. So you really want to make sure that that crupper is comfortable and perhaps addressing the tail after they've worn a crupper. Um, if they pull back and if they sit down or their tail is like caught on something, and they, kind of sit down and their tail's caught on a bar or, especially some horses really like to rub their tail. That's actually another problem. If you see a horse that is rubbing their tail a lot, like old fashioned, we'd say, oh, they've probably got worms. Well, there's a chance, but often it's nerve irritation, um, and fascial tension, and like there's a problem there because I've seen that. And then we've addressed like sacropelvic lumbar dysfunction, and they've stopped needing to rub their tail. Like they're just normal now. So that can be caused by sacropelvic issues. I've heard of horses that have degloved their tail, like they've had it caught somewhere and they've just like completely taken the whole skin off it, or pulled their tail off. That's like pretty bad. The float is a big one. Leaning against the float is a really good way to cause a tail restriction, but then I would say there's a reason that they're leaning against the float as well. So you want to look at, not just the tail, because that could be a consequence of the reason that, they're struggling with their balance or there's something else going on there and they're leaning against the float. I've been in trouble a couple of times for cutting people's horses' tails. I think I was banned by one of my clients because I cut a show tail. I hate long tails. I just think that it's not fair on the horse that their tail is long and that they can step on it. And it just like pulling on all those muscles we've just talked about, all those connections. And so, yeah, I'll often be like, can I cut your horse's tail or can you cut your horse's tail? Because it's just unnecessary that the tail is dragging along the ground. So I shouldn't be doing that. Mm.
Another, you mentioned it before that there's a different name for it, a grabbing the tail and twisting it around as a almost like a twitch for a foal. What was the word you used with a cow?
A tail jack.
A tail jack. I hadn't heard that term before. So it's basically like a twisting around of the tail.
Some
It's
people do it
really,
in folds. Don't do it. It fits in the ear twitch category.
yeah, yeah, it's yeah, too many risks there of
But they use it
influencing.
in cows a fair bit. I remember using it in cows to
Yeah.
stop them from kicking you when you're giving them an epidural.
Okay. Yeah, I didn't even
I
think of
forgot
that.
about
Yeah.
it. Did you
Yeah.
remember? Yeah.
Yeah, yeah. And of course, you've got compensatory tail postures, like you talked about lameness, etc. But you know, the tail itself can become very tense and uncomfortable because it's accommodating or being used as a rudder or, kind of pulling balance and holding tension.
Balance. Yeah. I guess that's another time that you can see a problem with the tail. When the horse has a neurological condition and they're struggling with their balance, then often they do like it'll go in stiff and weird. And
Yes.
like it's trying to, it's trying to give some more stability, like,
Yeah,
yeah, some more balance. And so that's another cause, like an underlying neurological condition.
absolutely. Any other comments about causes of issues?
No, I think just if your horse's tail's uncomfortable, don't ride it. Just figure it out first because by putting more pressure on the back, you're actually adding to that tail tension. And, it can just be another one of those checks that give you information about your horse. So
Yeah.
there's so many little things that you can do that just give you more information. And it is significant. So, if someone says, "Oh, don't worry about it," well, it's got a lot of significant connections. So, yeah.
Yeah. Wonderful.
So, what's our responsibility then? Our,
Our yeah, our responsibility is awareness, really, like to keep our eyes open, to be looking and watching to see how the tail looks and feels. You can ask your body worker to check. You can go and pick up the tail and say, what does it feel like? Can I lift it? Can I move it to the side? How does my horse feel about this? And keeping your horse's tail at a length where it doesn't drag on the ground and they're not going to step on it. I also do think that there is, obviously they're not in there always for a very long time, but very heavy show tails are
Mm,
also, that it's a pull on your horse's body. So, just worth considering that if you're somebody who uses them, just think about how long you use them for or the weight.
yeah.
And yeah,
Maybe
just paying,
maybe
yeah,
getting your horse used to them as well. Like I'm sure they
yes.
people do, but just thinking of how it could change their mechanics.
Definitely. Listening to tension in the tail as well. So just paying attention, like you said, you can use the shadows, film yourself, and just see, how does the horse carry their tail when they're moving around in the paddock and doing things.
Yeah, and the last one would be looking at the tail in urination and defecation. Like one thing that just raised an alarm bell for me that I hadn't fully connected was I talked about Ellie's like tension in her tail, and then I realized, yeah, she wheezes on her tail sometimes, and that's actually improved. So, like if they're weeing on their tail, they're not getting it out of the way properly.
Yeah.
If, have a look at their tail position when they do defecate and urinate. Um, there's just another bit of information that you can carry forward.
Yeah, especially because it's one of those things that you're just like, oh, you've managed to wear on your tail a bit, but horses are so self-aware. Most of them, there's always a few little grots amongst them, but most of them don't like to wee on themselves.
No, no. Awesome. Well, I hope you've enjoyed today's Tales of the Tail. Before we finish today, I wanted to share something with you, as I've shared in the last few podcasts. The Equine Functional Posture podcast has grown into a really special space, one focused on education, welfare, curiosity, and a deeper understanding of the horse. As the podcast continues to grow, we're opening the door to a small number of aligned sponsors who share these values and genuinely support horse wellbeing, education, and ethical practice. So if you know of a brand or a practitioner or a business who you feel is connected to the way of our podcast, then you're welcome to reach out or get them to reach out. You'll find details in the show notes. Otherwise, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time and your observing. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights. And reach out with any listener requests for topics that you'd like to hear about.
See you in the next exciting episode.